Good afternoon, everyone. My name is Jessica, and today I will be presenting about hearing loss that is associated with Usher syndrome. I will begin my presentation with an introduction of Usher syndrome, and I will include a description of the various types, as well as characteristics that are associated with each type. And I will end with a presentation of the treatment options that are available for individuals regarding their hearing loss. Usher syndrome is an autosomal recessive disorder that is congenital and progressive in nature. Individuals with Usher syndrome may be characterized by having a sensory neural hearing loss that is bilateral, as well as include a diagnosis of retinitis pigmentosa, or known as RP for the duration of this presentation, and this is the progressive loss of vision. Individuals with Usher syndrome will also present with a dysfunction of their vestibular system affecting their overall balance. Usher syndrome may present in one of three types, and each type is differentiated by the combination and the degree of the presented characteristics. And I will go through these three types in further detail in the following slides. Usher syndrome affects an estimated number of 3 to 6 per 100,000 individuals and is currently the leading cause of an inherited progressive combination of vision and hearing loss in the United States. Usher syndrome is categorized into three major types, and each type is distinguished by the severity of their hearing loss, the presence of vestibular dysfunction, and the age of onset of their symptoms. So beginning with type 1, Usher syndrome, type 1 is associated with a severe to profound sensory neural hearing loss, in addition to a progressive vision loss that will begin in childhood. Individuals with type 1 of Usher syndrome will also present with abnormalities of their vestibular system affecting their balance. Moving to type 2, Usher syndrome type 2 is characterized by a severe to profound hearing loss that is present at birth, as well as a progressive vision loss that begins in adolescence or adulthood. Individuals with type 2 will have an intact vestibular system, differing from type 1 or type 3. And Usher syndrome type 3 is associated with a gradual hearing loss as well as vision loss, and both will have an onset during childhood. The hearing loss associated with Usher syndrome type 3 is progressive in nature, and it will progress to a profound hearing loss by adolescence. And as I previously mentioned, Usher syndrome is an autosomal recessive disorder, and each type is caused by a mutation of a specific gene. If you'll have a look at the chart that's referenced on the slide, I've split up the different types of Usher syndrome, and then I've also added the associated gene beneath each different type. I'm not going to go into too specific detail about each gene, but I did want to point out that type 1 of Usher syndrome is the most common, and the most common gene mutation occurs in the MY07A gene. And during these gene mutations, what is affected with Usher syndrome is the overall development of the cochlea in the inner ear, specifically the hair cells that assist in hearing for individuals. So this is where the hearing loss is presented, and this is the mutation that causes the severe to profound sensory neural hearing loss. And as I mentioned, all types of Usher syndrome are inherited in an autosomal recessive pattern, which means that both copies of a gene in each cell have a mutation. So the parents of an individual with Usher syndrome will each carry one copy of a mutated gene, but the parents themselves do not have the condition. Currently, there is not a cure for Usher syndrome, but there has been development of many different treatment options specifically for all of the symptoms, and for the duration of this presentation, I will be focusing on the hearing loss that is associated with Usher syndrome. So treatment for hearing loss involves management of the loss by utilizing a specific type of assistive technology. So there are many available treatment options for individuals with Usher syndrome, and these include cochlear implantation, the use of external hearing aids, participation in auditory verbal therapy that would be facilitated by a speech-language pathologist, or learning American Sign Language as their language of choice, and to be their expressive mode of communication by using ASL. But within the current literature, research suggests that most individuals with Usher syndrome receive significant benefit from a cochlear implantation in many different areas. but the most significant area of impact is seen in an individual's oral language abilities. In a study conducted by Lodon et al., the best perceived outcomes for oral language were observed in individuals that received a cochlear implant by the age of 9. So as individuals with Usher syndrome present with a sensory neural hearing loss that falls within the severe to profound degree range, this makes them eligible for cochlear implants. And it also makes cochlear implantation an appropriate treatment option for all individuals with Usher syndrome. As we have learned, early implantation is extremely important for any individual with hearing loss, specifically because it leads to more positive outcomes for language development. And research suggests that there is a significant benefit seen from cochlear implantations in individuals with Usher syndrome, making this a preferred choice of treatment options for these individuals. And this is a list of my references that were used within this presentation. I wanted to thank you for listening to this presentation and learning a little bit more about Usher syndrome.